As COVID-19 cases continue to rise in the Ashanti region, some basic and senior high schools, as well as tertiary institutions, have not been spared. Currently, 25 of these schools have active cases out of the 85 schools which have recorded COVID-19 cases so far. The Ashanti Regional Director of the Ghana Health Service, Dr. Emmanuel Tinkran, did not disclose the affected schools, but he attributed the latest trend to the disregard of safety protocols in these schools.
So all that we need is the leadership who are committed to get things done in the schools. Unfortunately, this we are not seeing in the schools. I've had opportunity of visiting. Sometimes I go unannounced just to go and see what is happening in the schools. You will go there, especially the boarding schools, and you realize that within the school environment, within the four walls of that school, they've disregarded the protocol. The children are not wearing the face mask. The teachers who are supposed to supervise them do not care what they are doing. Meanwhile, there's a head of facility. You see, so one thing is that it's the commitment that we need.
The Conference of Heads of Assisted Secondary Schools, CHAS, which manages public senior high schools, has also expressed worry over the number of cases recorded in schools and pledged to step up supervision to deal with the issue.
It's a worrying situation to us, and as schools, we are also going to step up our surveillance and supervision to ensure that our students, staff, all adhere to the protocols of the COVID-19 so that we are able to reduce its effects at the school level as much as possible. You will agree with me that at the school level, somehow we are facing a challenge of human interaction. As of now, these students commute from home, and so when they leave the school, after you have taken care of them and ensured that they do what is expected of them, immediately they step out of the walls of the schools. They are no more under the control of the school.
CHAS has, however, appealed to the government to aid in the provision of Veronica buckets and other PPEs to help in the enforcement of the safety protocols.
Let me take this opportunity to also appeal to authorities that the COVID-19 PPEs that are required for effective management of it should be looked at. As for the nose masks, it has become something like virtually everybody has it, and thank God the price of it has gone so low that it's not a big deal. But we're talking of the Veronica buckets, we're talking of the liquid soap, and the sanitizers.
The Ashanti region currently has 1,135 active cases, with a number of new cases recorded between 19th and 25th July 2021 being 783. Dr. Emmanuel Tinkran provided more details.
So far, we have 11 on admission with severe form of the disease. 7 are moderate, 5 are mild, and then 3 are critical. So far, 2 treatment centers are working. That's Komfanoche and then the Kumasi Sub Hospital. The staff so far infected. We have 151 doctors. That accounts for 9.5% of the infection. Nurses are 868, 54.4, and then all others 576.
For health authorities in the Ashanti region, the surge in cases can largely be attributed to total disregard for COVID-19 safety protocols.
I will call it total disregard of COVID-19 safety protocols by majority of the public. In fact, last week, as an assignment, I went around visiting so many funerals that's being organized in the region. And I tried to count the number of people who were wearing face masks. And to be very sincere with you, less than 10% of those who were in the funerals were wearing face masks.
The Health Directorate is also worried over the cost of COVID tests at some private health facilities in the region.
It's an offense to charge for any COVID test apart from those that you are going to use to travel outside the country. So I'm encouraging all the facility heads, whether private or public, to adhere to these very important guidelines, and that's going to help us.
President Akufo-Addo, during his latest address on the COVID-19 situation to the nation, said the wearing of the masks remained mandatory, but that was not the case in some busy areas in the Kumasi metropolis, especially the central business district of Edum.
Sometimes I feel busy and stressful when I wear it. I'm feeling I get more stressful when I wear it.
Don't you think that catching the virus or maybe you being infected is more serious than you not wearing it?
I think the virus is not there.
Why do you think so?
Because we don't record the cases, and I think they've stopped checking it, so it's not there.
Se me max na I say me pressure no e kwosoro tesa mentimi ya na mabre anytime me share max no ye peska na de abobla o nye max asem ye wo man mu ha na ehu so mo abaye yie e wo krom ha kọ nye mpanimfo na ye ntima mu ha na ombaye yie se jo yie kofo ayi ebla ayi ni no mo abaye kọ eno no mo anwene ye timememfo no ho.
For this woman, the security agencies must be deployed to enforce the directive.
I can be a victim, and I don't want to die. I have children, grandchildren. I want to live to 90 years before I die. So I am worried. They should obey the president. That's why I'm wearing mine. Since I'm wearing mine, you could see that I am worried for those who are not wearing them.
Majority of residents within the Kumasi metropolis are still not putting on their masks even after the address by President Akufo-Addo. This is becoming a worrying concern for health authorities in the region. From Kumasi in the Ashanti region, Hafiz Tijani for City News.